Hello, this is State Senator Dale Ryder, and welcome to the latest edition of the 2-Minute Drill. Today is Thursday, April 25th, and I'm coming to you today from inside the state capitol where the Senate has wrapped up its work for the week. I want to talk to you about a couple issues that we've talked about before, but both need to be updated. First, with regards to our ongoing efforts to make sure the Medicaid program truly serves just those people who need assistance from state government when it comes to their health insurance and health care needs. As you know, last year we passed a substantive Medicaid health care reform bill that had 62 provisions. One of those provisions required the Department of Health Care and Family Services, which is the agency that oversees Medicaid, to bring in a private contractor to help scrub the rolls, if you will. In other words, look at the list of people who are currently on Medicaid to make sure that just those people who fit the eligibility criteria are actually being served by the program. That private contractor, Maximus, thus far has examined about 44,000 cases here in this state. Of that number, 17,800, or almost 40% of those cases have been reviewed, have been deemed to be ineligible. 4 out of every 10 have been deemed to be ineligible. Now, that percentage will come down as the review goes on, probably. Having said that, it indicates clearly what we've known from past years' audits and from anecdotal stories I hear all across my district and all across the state. And that is that there are many, many people who are on the Medicaid program who should not be on the program. In order, again, to make sure that those who truly need the program are best served, we need to remove those who shouldn't be on the program. The second issue I want to update you on has to do with the crisis in education funding for public schools, particularly downstate. We've talked about before the fact that there are 2 factors that lead to this funding crisis. One has been the trend in the last 10 years to replace education, which used to be the #1 funding priority in the state, with programs of public assistance, including the Medicaid program. Despite what some of our state's leaders say, education is not the #1 priority in the state anymore, and it needs to retain that position, needs to get back to that position. The second issue that's created a problem for us, that of that money that's left over for public education, more and more of it is being directed intentionally by the state's leaders to the Chicago public school system. That process needs to reverse itself. But like in most areas of life, in order to truly remedy a problem, you have to first understand the problem, and that means we need greater transparency in the budgeting process. Right now, the budget process with regards to public education funding is not transparent at all. Very few people can look at a budget book right now and understand exactly how public education money is being spent. We need to remedy that, and I am part of an effort that many of my Republican colleagues, and hopefully at least a few of the Democrats, will join in to make sure there's real transparency with regards to the budgeting process, so that you and I and everyone else in my district can look at a budget book and understand exactly where our taxpayer dollars are going when it comes to helping our downstate schools. With that, thanks again for joining us for another edition of the 2-Minute Drill. Have a great weekend.